Leader of the third party.
Thank you, Honourable Speaker. It's been fascinating to hear 4 questions from the official opposition and 4 responses from the government on this issue. In the last 100 days since we haven't been sitting, 600 people have died. We know what they have died from. They have died from a poisonous drug supply. And yet, in the 4 questions we've heard and the 4 responses we've heard about overtures to the federal government for decriminalization, social workers, safe injection sites, other harm reduction methods, new waves of measures. It's a tragedy. But nobody has spoken about a regulated safe supply, which is what experts, doctors, healthcare workers, and advocates have made clear, that if we want people to stop dying in this province at the rate of 6 people per day, then the poisonous illicit drug supply needs to be replaced with a regulated safe supply. My question to you, Honourable Speaker, is to the Minister of Mental Health and Addictions. Will we see steps taken to ensure that it is not a poisonous drug supply that is killing British Columbians every day?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. My previous minister, my friend and predecessor, Judy Darcy, the Minister of Health and the Public Health Officer were already working on safe supply as a way to separate people from the toxic drug supply, because what we're hearing from people on the ground and from families is that it was toxic drug supply that was killing people. When the pandemic hit, within 2 weeks, we were able to implement quickly through public health orders and through cooperation across all of government, prescribed safer supply. The uptake in that in the month since, year and a half since, has been a 425% increase in the number of people that are receiving prescribed safe supply. In July, I stood with Dr. Bonnie Henry and we announced an expansion of that prescribed safe supply. Nobody else in Canada is doing this. That people now can be prescribed a fentanyl patch for the purpose of avoiding an overdose is unprecedented. We're grateful to the frontline nurse practitioners and addictions medicine doctors that helped us design the system, those brave frontline people, particularly in the downtown east side, who have piloted this work, and we are continuing to expand it every week with every health authority across the province. We're determined to do more, and there's more to do.
Leader of the third party, supplemental.
Thank you, Honourable Speaker, and I appreciate the Minister's response. I think it's important to note that prescribed safe supply presents an extraordinary barrier for people, particularly those who have had less than ideal interactions with the healthcare system. And when we consider, for example, the indications and evidence of systemic racism for Indigenous people in the healthcare system and the number of Indigenous people dying from a toxic drug supply, we need to be able to go beyond what is existing right now. In July, Crosstown Clinic in Vancouver started providing safe medical-grade heroin for patients to take home. It was the first of its kind on this continent, and the dozen or so initial patients said it was humanizing. It was humanizing not to have to line up daily for their doses. It lets people take on jobs, spend time with loved ones, and take care of their families. But just last week, this program was quietly cancelled. No word from the Minister of Health, the Minister of Mental Health and Addictions, or Vancouver Health has been received. When we compare ourselves to the lowest denominator, we are the most progressive in North America, and yet we have the 3rd highest death rate from the toxic drug supply in North America. This government needs greater ambition if we are to truly save people from this toxic supply, and that starts with transparency on progress and a commitment to maintaining programs that remove the influence of illicit drugs. My question, Honourable Speaker, through you, is to the Minister of Mental Health and Addictions. Why was the regulated heroin program cancelled only months after it started, and what is the Minister doing to not only get it back up and running, but to expand it?
Minister.
Thank you, Mr. Speaker. The work of Crosstown Clinic and multiple other service providers in Vancouver and across British Columbia is saving lives, breaking new ground, working within the framework that the federal legislation requires. We are learning lots from them, and we are removing barriers wherever we can. The Crosstown Clinic home carry program that the member references has not been cancelled, but the 11 people that are receiving that groundbreaking service delivery as another way to separate them from the toxic drug supply have encountered a barrier through the College of Pharmacists that we are working hard right now to resolve. I spoke just this morning with Dr. Scott McDonald, the lead on this. The program is not cancelled. Those people are still receiving the treatment that they need, the medication that they need, but the home carry piece, which had been working well, is now through the college is a conversation that we are having, and I'd be very happy to update the member on what I learn in coming days. We're working hard to resolve it.